Hello, this is Kevin Trubenbach with the Transition Health Benefits team, and I'm going to be going over in this short video the 2026 Buyer's Guide for Health Insurance. Remember, the rates go live on November 1st of 2025. When you hear the word ACA, Marketplace, healthcare.gov, Obamacare plans, we represent those in Wisconsin and several other states at no cost to you, but all of those mean the same thing. We also offer different Medicare plan options and alternative health insurance plans. Open enrollment starts November 1st, 2025 through January 15th, 2026. If you apply by December 15th, you get a January 1st. From December 16th, you get a February 1st. And note, in 2027, the open enrollment period will only be for 45 days from November 1st through December 15th. I guarantee you're going to learn at least one thing today. You may work with myself, or here's a list of some of our THB associates. From here, and this document is fully downloaded in the description below, but you can click here for our contacts. The Inflation Reduction Act, which signed into law by President Biden back in August of 2022, extended the enhanced subsidies under the Affordable Care Act. These enhanced subsidies are scheduled to expire on December 31st, 2025. What does that mean? Beginning in 2026, individuals earning more than 400% of the federal poverty level will no longer qualify for tax credits or subsidies. This cutoff is commonly referred to as the subsidy cliff. Example, in 2026, a household of two must earn no more than $84,600 to qualify for a subsidy. So for example, if you estimate your income at $80,000, but your actual income ends up being $90,000, you will no longer qualify. If you're receiving $500 a month in subsidy, that adds up to $6,000 a year. You'll have to pay that back at tax time. Stay tuned. Tax strategy for 2026. These are based on your household, the subsidy cliff. So based on where you're at with your household, that will be the determining factor if you qualify for a subsidy. The other simplest way on November 1st, and in this description, on November 1st, those links will go live with 2026 pricing and subsidies. Remember, if you do make lower income, you can qualify for what's known as these special cost sharing reduction plans. So you can see here for a single, if I was a single and you make from $15,650 to $23,475, you can qualify for a special cost sharing plan. All that means is that the plan and the benefits are lower than the typical Affordable Care Act plan design. So they're a special plan due to the lower income that the government gives you. Note, you can only get those plans and purchase those plans in the silver category to qualify for the extra savings. Our system shows a little CSR. If you're on healthcare.gov, it's going to show the extra savings. And here it is the subsidy cliff for 2026. And if you make lower income, lower the income, the more subsidy you're going to get. This is the tax saving strategy. Did you know? New for 2026, this is in the big beautiful bill, all bronze and catastrophic plans purchased through a state healthcare exchange will be H.S.A. eligible. So you no longer need to buy an H.S.A. qualified plan to contribute to an H.S.A. All bronze and catastrophic will be H.S.A. qualified, so you can actually buy some of these $0 deductible plans and still put money away into an H.S.A. account. I already talked about open enrollment. New for 2026, as I mentioned, the H.S.A. With an H.S.A. health savings account, you can contribute for an individual up to $4,400, families $8,750, and if you're over age 55, you can do a $1,000 catch-up contribution. HSAs are a great way to lower your taxable income. Contributions are tax deductible. earnings grow tax-free. Withdrawals for qualified medical expenses are also tax-free. You can set up a local H.S.A. account at your bank and fund it in 2026 so that you can get that taxable deduction. Remember, in 2026, you're making your best guess on the household income. The healthcare.gov marketplace I mentioned, it all means the same thing. The amount you owe or get back is going to be a few dollars come tax time unless you are over the 400%. You will owe back all the subsidy. How you get that back is when you file your taxes, it's either the difference in the subsidy that you will owe or get back at tax time. So open an H.S.A. account in 2026, contribute to it, save money, and lower your taxable income. So key provisions with the Affordable Care Act. Remember, the health insurance marketplace, almost majority of the plans, you have to use in-network providers unless it's an emergency situation. The plans that are offered are bronze, silver, gold, and platinum, and also the catastrophic. And the subsidies and or the tax credits, it's going to be your estimated household income, which will determine your rate and plan options. So that's the Affordable Care Act with the tax credits, how to lower your income with the H.S.A. The Affordable Care Act, they have to cover pre-existing conditions. They have to cover the essential health extras or benefits. That includes services like emergency care, hospitalization, maternity, newborn care, mental health services, and prescription drugs. Dependents, if you're claiming them, can stay on your plan through the age of 26. Does not matter about their marital status. Preventative services are covered without charging any copayment or coinsurance, even if the deductible has not been met. These services include screenings, vaccinations, counseling, and remember, you must use in-network providers. This is a little guide on when you're looking at different ACA plans, what's the providers, are your doctors in there, the cost sharing, the prescriptions, what's the out-of-pocket maximum. Transition health benefits, we're here to help everybody from start to finish. For the most of you, if you're getting some type of renewal from your Affordable Care Act plan, whatever state you're in, most of those renewals that you're getting from the insurance carrier are more than likely wrong. Because by the time they printed those letters, they did not have the 2026 subsidies. So when the letters were printed, they didn't have the subsidies yet. Why that's important to see what your subsidy amount will be in 2026. 99% of the time, it's going to be different from 2025. As I mentioned, you can use our links in the description below. In under 2 minutes, you can figure out what your subsidy is going to be in 2026. If you're working with an agent, the new rules as of 2024, your agents must get your consent and attestation to work with you. We have a consent form on our website. Once we figure out a plan, we can help you obtain the attestation form. If you work with one of our associates, obviously you can click here and they'll show you all of our associates. You can pick one to work with. Our main state is Wisconsin, but we do sell in multiple reminders and some more tips for 2026. Multiple ACA carriers have announced they are no longer offering plans in many states. In the great state of Wisconsin, ACA carriers like Molina Health Plan, Chorus Community Health Plan are no longer offering plans in the state of Wisconsin. Select counties for courts and common ground, they are no longer offering in certain counties. Contact us, we can help. Nationally, Aetna, they do not sell in Wisconsin, but they sell in multiple other states. They are no longer offering ACA plans. You can click here to read about the article from Aetna. So if you do not qualify for a subsidy, we do have alternative health plans. The short-term medical programs are back. Short-term plans are now available again in many states with durations ranging from 3 months to 3 years. It depends on your state rules. For example, in Wisconsin, you can choose a short-term plan lasting anywhere from 1 month to 18 months, no longer limited to just 90 days. So if you do not qualify for a subsidy, remember short-term plans do not cover pre-existing conditions. might be an alternative option for you to consider. Please, buyer beware. If you're on social media and you see ads about private health insurance or a national PPO with a zero deductible, or if they're offering a Visa gift card, feel free to seek more information. However, if they refuse to provide details via email, consider it a red flag and disengage, as it may be a scam. What you want to find out? Ask them this crucial question. If you have a $100,000 claim, how much will your plan cover? They should be able to give you a number. If they cannot give you a number, then guess what? This inquiry will help determine the reliability of their coverage. If they cannot give you an answer, hang up. These are some of the ads that are out there. Also, for emergency care, all plans have to cover you in network because of the No Surprise Act. You can read about it here. Feel free to watch about how to use our quoting tool for enrollment into 2026. Look for these plan designs in 2026. They're available in 2024 and in 2025, and most of the Wisconsin carriers are coming back with these plans. They'll be offering a $0 deductible bronze plan. Some may have a silver. Remember, for an H.S.A. to contribute, you have to buy a bronze plan. It's a $0 deductible copay plan. You have copays for services with no deductible. Those copays all go towards your maximum out of pocket. And yes, 2026, the maximum out of pockets can be no more than $10,600 for individuals and $21,200 for families. This is up from $1,400 for individuals and $2,800 for families versus 2025. But keep an eye out for those plans. We're here to help you, guide you through this wonderful world of insurance. Feel free to share this with any friends, family, coworkers who are confused or need insurance. Check out our agency. We have over 600 Google reviews. Please consider writing a Google review. Follow us on our social media on Facebook, LinkedIn. Smash the thumbs up on YouTube here, and that would be great. Here are all of our links for our associates, and I thank you so much. Please comment below if you did learn something. We're here to help. Thank you so much.